Good afternoon and welcome to Ask the Doctors on Whitewater Community Television's WGTV Channel 11. I'm Eric Marsh, your host for this show, and thank you very much for joining us. We took a week off from being live, so we are back to actually take your questions and talk to our doctors who are here with us today. Thank you, gentlemen, once again. Dr. Thomas Huth, Reed Health, Dr. David Jetmore, Wayne County Health Department. We haven't had a chance to speak live for a couple of weeks, so we'll start with you. I think I keep going back and forth, okay? So, Dr. Jetmore, what have you learned? What have you found out this week? Let's not go.
Well, Eric, I think people are always interested in knowing what's happening locally. We know, we look at the news in the evening across the United States, and the virus is going up in the majority of the states, 38 to be exact. 10 or 12 are treading water, 2 they're going down. Indiana is one of those states where the number of cases is going up. As far as Wayne County goes, we have seen an uptrend as well. We had been seeing 2 or 3 cases of COVID a day. Last weekend, our testing site reported 13 cases going from Thursday through Monday, and that 2 of those days were closed because of the holiday. Then Tuesday, we had 2 cases, which was great. Then Wednesday, we had 9 cases, and then yesterday on Thursday, we had 10. So this is not a trend we want to see persist. I think, I don't think any of us, myself included, want to go back to the way things were before. Mm-hmm. And I think I just want to remind everybody that it's so important to socially distance and wear masks. Everybody that is a clerk in a store or is working with the public is required to wear a mask. This was mandated by the city back in May, and I think many of these people think that this is just something they can choose whether or not they want to do, but they've been required to do this. So we want to see all of those people in masks. I don't, and I think I'm speaking for all of us, want to go back to the way we were, but we're in control of this. If we wear masks, socially distance, and are conscious of what's happening, we can keep these cases down and keep going forward.
Dr. Huth, how about you?
Well, I think for me, for this week, probably the news continues to be the increase in cases across the country. And really, I start looking at the world level, and I think overnight the world transitioned to above 12 million cases worldwide and about 580,000 deaths, something like that. And the U.S. is fully 1/4 of the cases in the world. But I'm continually interested and kind of fascinated by the fact that it's largely 4 states driving the increase in the U.S., and it's the same ones that I've been paying attention to for several weeks. California, Texas, Florida, Arizona are the big 4. But of course, as Dr. Jetmore's mentioned, a lot of states are having increases, but in terms of just sheer contribution to the numbers, those 4 states are accounting for between 50 and 60% of the total cases and increases in the U.S. And actually, the biggest shares is from California and particularly Los Angeles County. So I think this really is kind of more of an urban phenomenon, and I know some of the localities in certain states have gotten to the point of stressing some of their resources, Texas and Florida and elsewhere. But the thing I notice is that even in those states, the total availability of resources is still high enough that if they could just match up, the ICU beds and ventilators better to where the patients are, they would have less stress. So I think it's a little bit more of to me, that says it's a little bit more of a resource allocation issue. But, we don't want to see those numbers go higher. And some places are a lot closer to exceeding their total capacity, and so that's not a good thing. Now in Indiana, the thing I noticed is that while there have been some increases, it's not as dramatic as elsewhere, and that's good. Not as dramatic as in Ohio. Ohio's had a lot bigger increase in the last few weeks, and but in Indiana, there seems to be a focus on some of the northern counties, Elkhart County and so forth, and a concern about increases in certain demographics, particularly the Latino population, and also an outbreak amongst the Amish that they've talked about for the last couple of weeks. So I think it's just interesting to pay attention to all these little things as they occur. Fortunately, here locally, as Dr. Jetmore's mentioned, things have remained relatively calm, though there may be some indications of increases. We're not seeing that too much yet at Reed, but we're monitoring the situation super closely. And before I move on, Eric, I want to mention one thing. I was at the orthopedic center on Monday, and a lady came up to me, a very nice lady called Terry, who said that she watches our show and appreciates it. So thank you, Eric, for inviting us here every week.
Thank you for being here. Thank you both for making the time to do that. A little bit later on this hour, we're going to have a chance to talk with Dr. Joe Byers, who is Reed's Chief of Pathology and Laboratory Medicine. This pandemic has had consequences in various areas. One of them is a blood shortage right now. So we're going to talk about that a little bit later on. But the conversation that has really kind of been driving things for the last number of weeks is what happens with school. And when we talk about school here in Wayne County, we're not only talking about K through 12, but we're talking about institutions of higher education. When you start factoring in the number of colleges that we have, there are a lot of students, some who are local, some who are coming in from outside of the area. So we have a chance right now to actually speak with IU East Chancellor Kathy Gerton, who is nice enough to join us today. Thank you, Chancellor, for spending some time with us. We appreciate it.
You're most welcome, Eric. Can you hear me okay?
We can. We can hear you great. Thank you. I know that you've got some other things to do, so we're not going to keep you long, but we kind of want to start with kind of a short look back. Can you tell us what the pandemic did to the day-to-day operations here on the campus?
Sure. We transitioned to all online teaching after spring break and to almost all employees working remotely. We set up a Wi-Fi hotspot in the Tom Raper parking lot for those who might need internet access. That's still available, and that's open to the public as well, so I'd like people to know that. Summer teaching was also moved to fully online. That we did have some face-to-face classes, but we already did a lot of online summer teaching, so that wasn't quite as much of a big change. Mm-hmm. Faculty and staff made the change to working remotely, working and teaching remotely very, very quickly. It was quite impressive. And now we all live on Zoom. Everybody.
We've had a chance, our staff, in and out here on campus a lot. It's been a lot quieter than I've ever seen it around here, to be perfectly honest. When you're thinking about reopening this place, and it does seem pretty closed up, you're not only thinking about what happens on this campus, but you also have to have conversations with people in Bloomington. You have to have conversations with faculty, staff. Talk a little bit about what that process is like between the regional campuses, this campus, and what concerns you're hearing from faculty, staff, and even some of the students.
Sure. IU had a restart committee that worked, set out parameters from a public health perspective. And then each campus formed a restart committee. So here at IU East, we had a restart committee. Then we formed 6 different subcommittees. And some of those actually split themselves up into subcommittees. So we had well over 100 people, faculty and staff from campus, working on various aspects of the restart, including things like class delivery options, campus life, student success, technology, and so on. A key aspect that all IU campuses were looking at is how to come back to the fall semester, and we haven't been gone, even though we might not be physically there. We're all still working, but what will the fall semester, the fall, and then of course the whole academic year look like? And how do we make sure that people are staying safe, just as the doctors have been talking about? So things have been changing so rapidly, and as we just heard, are continuing to change. So many of those aspects are firming up now, and I'd just like to assure people we will be on campus, but we are going to be de-densifying is the kind of phrase we're using. Some staff will continue to work remotely. Offices will be staffed, but the people may rotate in and out, so it will look different. We are very concerned with safety and the same things we were just hearing. Social distancing, masks, and hand washing. I noticed the doctors were wearing their masks as they came in because they came on campus. You have to wear masks if you come to campus. So that has been our biggest thing that we've been working on. And I think in terms of the concerns you mentioned, I would say the biggest concern is that everyone is concerned on making sure that our students have the best educational experience that they can, and that they are successful within the parameters that we have of trying to keep everyone safe. And the de-densifying means our classrooms hold many fewer students than they normally would. So we have always done a lot of online teaching, but there will be even more online teaching, but there will be face-to-face. Using the outdoors as much as possible. Social distancing is critical. The 6 foot around everybody, staying 6 feet away, and so on.
I know a lot of people have discussed online teaching as opposed to face-to-face teaching. I think maybe one of the advantages that IU East has in this is its history of online teaching. I know I've been on campus for more than a decade, and when I came, there was already online teaching going on. So there's a history of making that work well here, correct?
That's absolutely true. We have a long history of strong online teaching. Before the pandemic, about 60% of our credit hours were already online. So we have a lot of expertise. We have many faculty who have a lot of experience with that, and we have an excellent Center for Faculty Development that works to help continue to improve faculty skills in this area. So we actually have been able to provide a lot of expertise to colleagues both throughout the IU system and even beyond into K-12 and so on. So we have always done a lot of online. We'll be doing online, face-to-face, as well as what we call hybrid classes, kind of a mix of online and face-to-face, so that we can ensure social distancing. That's a key aspect of our fall semester. We're going to be starting at the same time, but one big difference is no face-to-face classes for the most part. There are a few exceptions with clinicals and so on, but no face-to-face classes after Thanksgiving, and they won't start up again until February 8th, actually, because that's a key virus season. I know we've got our doctors there, they understand this, and so you don't want people coming and going, traveling, coming back, potentially spreading viruses more widespread. So after Thanksgiving, things will be all online, and many universities are actually adopting this same kind of schedule.
I know a number of them are taking out fall breaks. Is that the same thing here?
Yes, same thing. We actually at IU East, we did not have an October break, so that's not a change for us. We had our break at Thanksgiving. That's not a change, but there also will be no spring break, and that is a change. Again, you don't want people going and coming back. So there is that.
Can you give us some, you talked about that, you talked about the doctors needing to wear masks if you come to campus. Can you talk about where people will be required to wear masks so that folks know that? And how does that affect what has become really kind of a thriving athletic program here at IU East? For those who don't know, the athletic program here at IU East has continued to ramp up through the years. How will COVID affect what happens in that particular arena also?
That's a very good question. I had a long meeting with our conference council presidents, many meetings we've been having about that, River States Conference. We will have to wear masks when indoors, and if a person is in a private office and they're just by themselves, they can remove their mask. But if they get up and walk down a hallway to the restroom, anything like that, have to wear a mask, wash your hands, keep things clean. All of those aspects are very important. We're encouraging outdoor visiting, and I think in terms of athletics, we have different guidelines to follow. We have IU guidelines. We have the guidelines from the NAIA, which is our overseeing athletic body, as well as our conference, the River States Conference. Right now, for example, there are no practices within the NAIA until August 15th, and no competitions until September 5th. And then as we think about our campus, say for indoor sports, let's say volleyball starts up, we are anticipating there would be no spectators at first, and then depending as things go on, and again, we know things are changing all the time, but at this stage, that is what, phasing slowly, bringing people in a way that they can be physically distant from each other that is safe. And again, masks. Wearing masks for the spectators. Many things, though, are still in flux, as I'm sure you all know, with the Ivy League just canceling their fall sports and so on. So I would say that for every single aspect of everything we talk about, everything is changing, and we have learned to adapt very, very quickly.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11. We've got a few minutes with Chancellor Kathy Gerton. I've kind of been hogging this. I'll let the doctors jump in real quickly.
Well, Kathy, Tom Heath here, I wanted to congratulate you on being proactive, on setting your standards for what I consider to be the fundamental, legs to the stool, the masking, distancing, hygiene standards, and I think you'll have much success with that. I'm hopeful with that you've got more mature students that they'll kind of grasp that and cooperate. I think that's something that at the younger age groups that the school administrators are struggling with, how to get young students to adhere to standards. But I want to ask you a question about testing. The state is not recommending for high school and below to do, pre-reentry testing, only to do that for students who are symptomatic. And I wonder if you all have put any thought into testing, or whether you have an idea about how you're going to handle testing on campus.
I have been in many meetings about testing this week and previous weeks, so it's still under discussion within IU, and this is an area Eric asked how we work with our campus plus within the larger context of IU. So a lot of things are still under discussion. Currently, we are looking at testing for symptomatic individuals, but also for screening for different types of situations. And Eric asked about athletics, so pre-screening of athletes. We also, all of our, we have to sign an agreement before coming back to campus that says things like you will take your temperature and you will not come in if you're not feeling well. We all have this thing that, oh my gosh, I don't feel well, but I'm going to come to work. But that is not what we want to happen. You're not feeling well. The thing to do is stay home. Do not come to campus if you're not feeling well. And you have to agree to abide by the mask wearing, hand washing, social distancing guidelines. So we are not at this stage looking at testing every single asymptomatic person before they come to campus. And one of the things that we think about is if you test someone, well, then they're tested then. But that doesn't mean 2 days from then, they may not come down with something, right? So you don't want to give us, I don't think you want to give a false sense of, I'm fine. Because individuals can be asymptomatic and still come down with something, as you know.
Kathy, this is Dave Jetmore. I don't see you anymore except on Zoom cameras.
I know.
But it's nice to be reassured that you still exist. This COVID season, especially we have a second wave, is going to coincide with the flu season. Have you got a plan for vaccinating all your students for the seasonal flu?
IU, again, we've got some stuff in draft format, and we will be looking at flu shots, absolutely, because, of course, you don't want two respiratory things going on at once. So, yes, IU is working on it's still, some of the plans are still being formalized. But yes, and we always do give flu shots on campus, but right now it's going to be even more important.
Yeah, that's right. That's great.
Yeah.
Chancellor, we appreciate the time. I know that you've got some other calls to do, and I know that there are conversations and topics that we didn't get to. Chancellor Girton has agreed to be my guest on a In Focus here in another week or so, where we'll spend the better part of the hour going through in more detail what's going to be happening, what the community can expect, and things of that nature. But we appreciate your time today greatly.
Well, thank you, and thank you to our doctors for everything that you're doing and our healthcare workers. We really appreciate it. Thank you.
Thank you.
Bye.
Chancellor Kathy Girton from Indiana University East. And you know, we think about the number of colleges that we have in this community and the number of students that are coming in from the outside. Do you all have any concerns? I mean, obviously, as people travel, that's always something. They're bringing something with them. You don't always know where they've been. And we don't always think about the number of students between IU East, Bethany Theological Seminary. Even here at IU East, there are a number of students, particularly athletes, that come in from outside the area. How do schools need to think about handling those things? I know some of them, and she mentioned it, the Ivy League canceled their fall sports season. I know that's going to drive some people crazy. I think the Big Ten is only talking about possibly conference only, trying to cut down on travel and things of that nature.
I think so much of this depends on the behavior of the people when they leave. You know, you're hopeful that your students, when they go home for holidays, are going to spend most of their time just with their family and are not going to go to large mass gatherings or foolish behavior that could get them infected and then, of course, bring the virus back. But you're right. Anytime you have, the more people you have, the more traveling you have, the greater the risk of the virus spreading. That's how it operates.
Well, you know, I think this is probably not as much an issue for IU East, which has a large commuter population, but I know that some of the larger universities that are highly residential are preparing separate dormitories for those who develop symptoms to go into to try to isolate and control exposure. And I think those things sound very reasonable. But I think the even so is still going to be key, that anybody that has any kind of symptoms really should be tested and then managed individually and quarantined and so forth. And I know that that's going to provoke challenges for universities to manage their operations, but it's kind of what needs to be done. And I'm thinking less about the students. The students are certainly very important, their health and safety, but the reality is they're not as likely to get sick as someone on the staff or amongst the academic staff who may have underlying conditions, and those are the people that we really want to make sure that we protect the most.
You know, I was talking last Wednesday with the Wayne County School Commissioners, Western Wayne County School Commissioners, and they told me that there were many teachers, especially teachers who were older, in their 60s, who were very fearful of returning to teach and really considering whether they wanted to return. And then I even see nationally that many teachers are considering early retirement rather than coming back to teach, which is alarming. Mm-hmm. Because these are our obviously our most experienced teachers, these older teachers, and we have a shortage of teachers to start with. So we want to make things as safe as we possibly can so that these people feel safe, because as Dr. Hughes said, these are the people that are most at risk, the teachers, the school bus drivers, the school nurse, the custodian. And we want to make those people feel comfortable and safe in the environment they're working in.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live, and this program is also available on CTV3 in Connorsville. This is Ask the Doctors, so let's see if we can get some of your questions in before we go to our next guest. Is it correct that this virus is possibly much more serious than the common flu? Is that why we are so worried about this? What's the big deal with it? I think
Dr. Hughes should take this, because I can see he's chomping at the bit.
Well, you know, one of the things that I am constantly monitoring are the case fatality rates. And I think when you really think about the severe outcomes, death is the worst one, right? So how does this virus compare to the ordinary flu season in terms of risk for death? And the jury is still out on that, but I think the reality is that probably the best performance in the world has the case fatality rate down around a 1%, 1.5%. That's still up to 10 times the case fatality rate for an ordinary flu season. Now, those numbers may change. That may improve. I hope it does. I hope that as we identify more cases, more low severity cases, that those case fatality rates will change. It's just that in parts of the world where they've done a better job of widely testing, that's about as good as it gets so far. So I think, when I think about the flu or whatever, I guess my other people are probably like me. I'm thinking about, well, what's the risk to me? And if I'm 30 or 40 years old and I'm perceiving that 30-year-olds, 35-year-olds don't typically get super ill with this, most recover uneventfully, almost all recover uneventfully in a reasonable period of time. And because I'm just thinking about my own little envelope that I carry around with me, that I don't perceive it as a big deal. But since I'm involved in healthcare and even with influenza, I always take the flu shot. I always try to make sure that I'm exercising precautions and so forth during flu season. Why? Not that I'm so worried about me, but I know that I can spread it to others. And in my clinical practice, I work with highly at-risk, elderly, institutionalized patients, and I'm a risk to them. So what we have to do as a society is to get everybody to recognize that they have a responsibility to other people. And that's going to be the key. And so even though the death rates are probably lower from COVID than originally we thought might be the case, I don't personally see it ever getting down to the level of even the flu, and we should keep that in mind.
Yeah, and I think this disease is not like the flu. I hear this, and I'm sure you do too, Dr. Huth, it's being compared to the flu. What's the big deal? Well, it is a big deal in that typically when you get the flu, you're sick, you recover, and you're back to where you were before. This disease may leave you with a lifetime diminished lung capacity. You may lose your sense of smell and taste, and it'll never come back. There may be permanent damage to your heart or your kidneys. And the disease itself can make people, take months to get back to feeling like they did before they were ill. And then coupled with 10 to 15 times the mortality of ordinary flu, this is clearly we're not making a big deal about this. I mean, this is a big deal. So it is certainly worthwhile to do everything you can not to catch this disease.
Okay. Let's see if we can get a couple more questions in before we go to our next guest. If kids don't get very sick, do they really need to wear masks at school?
Yes, they do. One of the things that we need to remember about this is that 45, let's call it half of the people that get this disease don't have any symptoms, but they've got a nose and mouth that's full of coronavirus. They're spreading the virus, and we know, despite everything negative I've heard about masks on social media, masks are a very effective way of stopping the droplet spread of this disease. This disease spreads by droplets from the nose and the mouth. The masks greatly mitigate that. So children who don't often get sick or what. And I know what the question poser is talking about. I mean, they got a healthy little kid. Does this little child need to wear a mask? Yes, they do. They need to wear a mask for their benefit and for the benefit of the other children. We're all in this together. We don't want this child to pick up coronavirus and spread it to others.
And I'm going to agree completely with that, with that, and maybe just say something in a slightly different way. I like to say that the mask is about protecting other people than the wearer, and I think that's a fundamental mistake that people make with, they assume the mask means that if I'm wearing a mask, that means I'm afraid of getting something. Well, it's probably true. There is still more research needed. It's probably true that it's better than nothing to protect towards protecting the healthy person, but really what it is about controlling the emissions of infected droplet-size particles from a sick person. 40% of whom don't know they've got the virus. Now, I think that's one very key thing that's different between COVID-19 and influenza. There's a much longer period of asymptomatic spread prior to the onset of symptoms, and a much higher number of people who have the disease, can spread it, have no or minimal symptoms anywhere in the course of their disease, yet they can spread it. It's very clear that this happens. More study is needed on all of this, but the whole idea behind masking is really about controlling that the spread of disease on an unaware basis. And I don't know if I'm infected as we sit here today. I haven't been tested recently. Yet when I go out in public, I wear my mask because I feel a sense of responsibility to you and to other people in public.
We are still able to get tested here in Wayne County as often as, is it once every 2 weeks or once a week?
Once every 48 hours.
Okay, once every 48 hours.
Yes.
Okay.
And you could be tested, you get the test. Say you got the test back in 24 hours, and then you visit your neighbor, and your neighbor says, "Well, I just found out I had COVID." Well, you can go back the next day and be tested again.
The free testing site, Monday through Friday, 8 a.m. to 8 p.m., 601 East Main Street. You can register there online before you go. They will take walk-ins, but they do prefer that you register, lhi.care/COVID testing. Reach out to the health department if you need some additional information. This has caused a number of problems. There was a slide that came up a little earlier, and they can bring it back up about a blood drive that's going on. There is a shortage of blood, and that tends to be an issue. So there is going to be a community blood drive Monday, July 27th from noon to 6:30 at the Reed Health PACE Center, which is actually on the west side, 2300 National Road West. Some of you remember it as the county market location. It's not that anymore. I've had a chance to be in there. Doesn't look anything like it did when it was a grocery store. Looks great. And you can also schedule for that, givingblood.org. And joining us on Zoom right now actually is Dr. Joe Byers, who's Reed's Chief of Pathology and Laboratory Medicine. I am going to step back and I am going to let the doctors handle this because I'm not going to pretend like I'm into this. So Dr. Byers, are you with us today?
I believe so. Thank you.
Okay.
Can you hear? Right.
We can hear you. Thank you for being with us. We only have the audio at this moment. We don't have video at this moment, but we can hear you, so we'll go with that, and maybe we'll get video. So Dr. Huth, I'm going to let you start.
Joe, thanks for being there with us, at least on audio today. Hopefully the visual will catch up, but if not, that's fine. And wanted to invite you on the show today to talk about the blood situation, and I think it's amazing to me this is something that's kind of gone under the radar a little bit. It's actually a national issue, but I don't detect much discussion of it. And we thought it'd be fun to talk to you about what is the situation here at Reed. Do we have a shortage, and what's behind it?
Yeah, Tom, we do have a shortage. What's behind it is COVID-19, the virus and everything we've done to try to reduce its impact. We shut down the schools appropriately and closed a lot of businesses. Basically all the things we've done to reduce large group gatherings has had this delayed effect of reducing our blood supply, because most of our blood drives occur in the corporate setting for corporate blood drives, college campuses, high schools. So most of those drives have been canceled. So it wasn't as noticeable when the hospitals were not operating, doing surgeries. But now that we're trying to play catch up and do surgeries again, we really are seeing a big shortage in our blood inventory. Like, we're running anywhere from 25 to 40%.
So when you say we're going back to doing surgeries, and sometimes we refer to those as elective surgery, we've always continued the emergency surgeries. But really, some of the so-called elective surgeries aren't really so elective, are they? I mean, if you need a hip replacement, or you have been waiting to have some heart disease, what kinds of surgeries are we seeing now that we need some of these products for?
Well, I mean, certainly in obstetrics, we need them, obstetrical surgeries. We have people coming in with GI bleeds that need abdominal surgeries. Cardiac surgeries are a big one too. It's all across the gamut. I mean, you have trauma-related surgeries as well that can use a large amount of blood pretty quickly.
So I know that during the period of lockdown, one of the things that went away was people weren't getting injured, but now people are back out on the road, and we're seeing accidents and so forth. And even at Reed, where we're not a level 1 trauma center, do we have traumas that need surgeries or need blood products sometimes?
Oh, absolutely. I mean, a helicopter just landed. So yeah, we certainly see our fair share of trauma. And those patients often need blood urgently. And we typically stock, 40 units of O positive blood that we can give quickly. And, we don't have 40 units right now. So like I said, we're running between 25 and 40% of our normal inventory. So
Are there other organizations, hospitals, and health systems in Indiana, Ohio, or the region that are having the same problems?
yeah, they are. I mean, we get our blood out of community blood centers in Dayton, and they serve 25 hospitals. So we're all kind of in this together, as we do blood drives, they're doing blood drives, and where the need is greatest is where the blood goes.
So what are some of the things that are being done to try to mitigate the shortage other than blood drives? Are there other things?
Well, I mean, blood drives are really the main thing, and just increasing community awareness that there is a blood shortage is really important, because since we don't have college campuses full of students and high schools full of students, and a lot of people are still working from home appropriately, we need to encourage our community members to really get out and go to these blood drives. I think more blood drives are key, and just the community knowing that it's so important right now is key.
So I know that we've typically had regular blood drives at Reed. Are we going to increase the frequency of those?
Yeah, definitely. We do typically have a few throughout the year, so we're going to have more blood drives, more interval blood drives, until we can get the numbers back up.
And Eric, I want to point out that this you highlighted the blood drive we're going to have at the PACE Center on July the 27th. And the PACE Center is a new structure of Reed's that's going to serve a particular service in the community with the elderly who are at risk of being institutionalized. But it's not operational yet, but the building is completely ready to go.
Yeah.
You said that you were there. It'll be a very accessible place. That's a very nice environment. That's not the hospital. Mm-hmm. For people to come, because there are still some people who are concerned about coming into the hospital even for things like a blood drive. Now, we did have 2 blood drives just in the last couple of weeks, I think, Dr. Byers, that had higher than usual donations which is very good, but we've still got a lot of ground to make up. And so we were talking yesterday with the senior administrators about maybe trying to have a blood drive, whether on campus at Reed or at the Pace Center or out in, or sponsor them out in community settings like maybe in Cambridge City or certainly in Connorsville, maybe about every few weeks. So I want to stop and see if Dr. Jetmore has anything to talk with Dr. Byers about before we let Dr. Byers get back to his regular job.
Well, I think you covered most of the things I was curious about, Tom. What's the shelf life of blood, Joe? How long does blood last once it's been collected?
Oh, it's like 3 days or so.
Okay, so this is not like we can collect a bunch of blood and just store it in a big room somewhere and our problems are solved. This has to be an ongoing commitment by the community to keep these supplies going.
Yeah, I mean, it's constantly in flux. So, you know, like we transfuse approximately 250 to 300 units a month. And we like to keep around 150 or so in our inventories.
How many is in your inventory now?
Well, it changes every day. It's at the beginning of the week, it was around 15%. I think it's a little higher now, but.
Okay. Well, hopefully some of the people looking in will think about donating blood, and this will help you, Joe.
The
Yeah, I hope
blood
so,
drives
too.
that you've had, and you mentioned that you've had a couple of blood drives. What have you heard from the people that are showing up as far as any concerns that they have? And you mentioned it, Dr. Huth, that you're still having people concerned about coming to the hospital. Are they concerned about a blood draw? They're still having someone up close on them, and for some people that is still a concern. And how do we mitigate that concern for people so that those who would normally give blood feel comfortable enough doing that?
Joe, do you have any comments on that?
Yeah. Well, I mean, I guess we have to just reinforce and let people know that, you know, this virus is spread through talking and breathing. I mean, it's expertly evolved to do that. And so we're taking measures, you know, to prevent that from happening. We all wear masks. You know, we're doing temperature checks at the door. The surfaces are regularly decontaminated. People wear gloves. So, you know, what we know works, we're doing, and we can only hope that individuals in the community understand that, and we can convey that message that it is a very safe place, and the likelihood of spread when you take those measures is pretty low.
Yeah, I like to say that maybe we've done such a good job of scaring people about COVID that they're afraid to go to the hospital appropriately, and we still see some people delaying and deferring care, and I think it's possible that for some people, not only the concerns you articulated, Eric, about somebody being up close and touching me and so forth, that could be a potential issue, but doing that inside the four walls of the hospital is kind of maybe a double whammy for some people. I gave blood 2 weeks ago. I can't do it again for another 6 weeks or so, or I would. But I have no concerns about those things. But then I'm an insider and understand how it works. The thing that I like to point out to people is that you should think about the safeguards that are being taken at the hospital. You come to the door, you get your temperature taken, you get asked questions about symptoms, you're asked to wear a mask, you're asked to sanitize before you're allowed to come in. That's a little bit like, it's analogous to being in the operating room. The reason why the operating room is a safe place for me to come get my ENT surgery, Dr. Jetmore is an ENT surgeon in a former life. The reason why it's safe for me to go do that in the operating room is because at the door, they make sure nobody comes in who's sick, who hasn't sanitized, who's not wearing a mask. You know, we take all these precautions to make a clean environment for me to be safely treated. That's what we've created at the hospital. And so I think it's actually the least likely place to catch COVID is at a blood drive at the hospital. But in order to allay any fears that anybody might have, we've got this great new space that's also very clean and safe. We're going to make sure it is so that people can have more accessibility for those who are concerned about that, in addition to trying to support blood drives out in other places in the community.
Dr. Joe Beyer, Reed's Chief of Pathology and Laboratory Medicine. Thank you for your time today.
Thank you so much for having me. I appreciate it.
Thanks, Joe.
Thank you, Joe.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. We do have time for some more questions, so you can send your questions to @WCTV Info, or you can also send them to us on Facebook. Will children of COVID-positive parents who are in the home be asked to stay home from school? What is that risk?
Well, if the parents are COVID positive, I mean, this is a positive contact when you're doing tracing is someone that's been in close proximity for 15 minutes, and obviously those children would meet those criteria. So they would be asked to self-quarantine along with their parents for 14 days.
Okay. Is there another question? Would you ride in a car with someone who does not always wear their mask when in public? You plan to wear a mask, but they might not. Would you ride in a car with someone who does not always wear their mask when in public?
Well, it's pretty hard to distance yourself 6 feet in a car. 6 feet is an enclosed space. I would be very reluctant to ride with somebody, and this is assuming this is somebody that's not part of your cohort, your wife, your children, maybe close friends that you've kind of been around. I think you can form these little groups, close friends, and kind of build a cohort. But I would be uncomfortable, and I wouldn't be afraid to ask them to wear a mask. I wouldn't be reluctant to provide them with a mask. If I'm picked up by somebody in a taxi, I would expect that taxi driver or that Uber driver to wear a mask. I would be uncomfortable otherwise.
Okay. We've got about 12 minutes or so left. We do have some more questions, so we're just going to kind of keep going. A local Amish store doesn't make their employees wear a mask. Are they exempt from wearing masks?
No, they are not. We've asked all the employees that deal with the public to wear a mask. If you've got a big store, if you've got people that are stocking shelves in the back of a store, working in a storeroom, or unloading a truck at a loading dock outside, those people aren't required to wear a mask. The other people have been mandated to wear a mask. They're required to wear a mask, and this mandate was put out by the city, I think, back in May, by the mayor and the commissioners. I've raised this question because I, like all of you, have been in stores and said, why aren't you ladies wearing a mask? And they reply, we didn't think we had to. We thought that was a choice they could make. Well, that's true for the public so far, but it's not true for people who are taking your money or your credit card at the cash register. So the people that are dealing with the public, those people should be wearing a mask, whether they're Amish or Mennonite or Catholic, in my case, or whatever. They're not exempted.
Are you finding that because it's been a while since, and you were saying this was March, I think maybe, that because back in March, the city, the county did this, and then a lot of people have been listening to the governor's messages, and the governor has been kind of releasing some things. Are people a little bit confused as to what the actual rules are and what's being governed? I mean, you go to Indianapolis now, and if you're in Marion County, you have to be wearing a mask if you're in a public building. That's not necessarily the case here. Are there so many hybrids going on that?
No, that's not the case here, and I think the reason is our fault. We put out this directive back in May, and we haven't reiterated it. And we've been in communication with the mayor and with the commissioners, and they agree with us that we need to put this back out there and tell people, yes, they need to be wearing a mask. We're in the middle of a pandemic. We need to be, and all of us should wear a mask. But so far, we haven't required the general public to wear a mask. And I don't want to do that. But if these numbers rise like they have in Marion County, Eric, we'll be forced to do that. We'll be forced to ask everyone to wear a mask.
Okay. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11. We're down to our last few minutes with Dr. Thomas Huth, Read Health. You can also still see him. I saw him on Twitter this morning. He's everywhere. Read Health put out a 1 minute, go find it, on Twitter with the doctor answering some questions, and also Wednesday evenings at 5 p.m. on WHIO. You're still
Correct.
there?
I'm still there.
Okay. Next question. Why does Read not set up? Does Read not set up for the more comfortable test, which is also free? And I think this goes back to a question that we had a couple of weeks ago when they were asking about the test that either goes all the way back to your nose and steals your dreams, or
Right.
what they're doing at the COVID site. Talk about the difference between the two and why Read is.
I guess in the question, we're kind of mixing a couple of issues. One is the comfortable test. One is the free part. It just happens that the testing that we have, the technology that we have, requires the nasopharyngeal sample. Unfortunately, the dream-stealing version. I've had that version of the test twice myself. I agree it's not the funnest thing to do. But you know what? I lived through it, and I could do it again. I expect to have to do it again in my work with, I mentioned earlier, I work with at-risk institutionalized elderly people, and for that I have to be tested periodically. That's a mandate from the state. But, you know, it's not that bad. So I wish we could do the nasal swab one routinely, but that's just not the technology that we have at the moment. We are looking at changing or adding technology that might be able to do that. The Hologic test, I think, could be a lower nasal swab version. Then there's the other part of the question is about the free. We just have to realize that the Optum testing really wasn't free. It's just that you weren't paying for it.
Right.
You know, the state provided the funding for that, or provides the funding for that, but it is not free. And at least in the beginning, they were asking people for insurance information. I don't know if they still do that or not. Now, at Read, you have to understand we've got investment in the technology to make the testing available. We've got to pay people to acquire the test, to run the test, and buy the supplies for it and so forth. And we're not allowed to just give it away. That's something we can't do under the circumstances. So we have priced it to be competitive with what the prices for similar testing in the marketplace is if you have to go pay for it. And that's where we're at the moment. We would love to be able to just kind of indiscriminately do testing, but that would be a challenge because of the costs involved without support like Optum has from the state.
We've got about 5 minutes left to go. One thing I want to try to do, and we've done this for a while, if you could talk us through the numbers. That the trend looks good at this moment for where we're going.
Right. So I've modified this slightly. I'm only showing the last 13 weeks or so. And we can see that the blue bar, which is all patients in isolation on an average daily basis during that given week, has continued to trend down, and that's good. And the next bar down, the middle one, the little red one, that's now almost invisible now.
Yeah, it's going away.
Is the laboratory positives in the hospital, and basically last week was an average of one patient positive in the hospital on any given day. And then the third bar down is the patients on ventilators with COVID. Known COVID patients on ventilators. Mm-hmm. Actually, we went through an 8-day period where there were none at all, which is why last week was 0, the week ending July the 4th. This week, so far, we've had an average about 1 a day. I guess technically that's an increase, but, it's not really. So we're going to watch that closely for any signs that we see any increases. Before we went on air, Dr. Jetmore and I were talking about the possible implications of the fact that the county health department is getting notified of more tests positive the last few days. And so that's just something to be aware of. But we're happy with the trend now, but the reality is we don't live in a little vacuum here of Wayne County or even Richmond. And we are going to move with what happens with the state. The state is starting to see some increases. We're on the border with Ohio. Ohio is definitely having increases. And Preble County, immediately next door to Wayne County in Ohio, is on the second level of alert in the Ohio State alert system. Montgomery County, which is Dayton, is on the high alert level. So, we are going to be influenced by all of that. So we would like to see more done in the region to take more precautions, reduce those numbers so we can keep our numbers low. Mandatory public masking is a thing in Dayton, Ohio now. It is or will soon be in Cincinnati. In fact, actually, the new Ohio executive order requires public masking in the red counties. There are 12 of them in the state in certain situations. And so I'm hopeful that that will help keep the COVID down around us so that we don't see much, if any, significant increase. But we're just going to have to wait and see what happens and hope that everybody's doing the responsible thing as we go along.
Okay. That's going to take us through another show. Dr. Thomas Huth, Vice President, Medical Affairs, Reed Health, Dr. David Jetmore, Wayne County Health Officer. Gentlemen, as always, we appreciate you giving up some of your time, coming in, answering the questions that we have on a given week.
It's our pleasure.
Thanks for having us, Eric.
Thank you very much. Free COVID testing, let's go through that one more time. Monday through Friday, 8 a.m. to 8 p.m., 601 East Main Street. You can register by visiting LHI Care COVID Testing. Also, reach out to the health department if you're in need of some help. Want to remind you of the blood drive that is going to be going on. You just heard a little bit ago, there is an urgent need for a community blood drive to happen, and more will be happening. This one is scheduled for Monday, July 27th, noon to 6:30, Reed Health Pace Center. That's the address, 2300 National Road West. Schedule ahead, and probably scheduling for this is probably a good thing, so you're not having backups and a lot of walk-ups. Hopefully you want to know that people are coming in. Givingblood.org is where you want to go with that. You've just heard it from the doctors. Masking up is incredibly important, and a couple of weeks ago we were holding up signs as to why we were masking. This is coming from the state. We hunkered down. Now it's time to mask up. They are asking that you do that and keep everybody as safe as possible. Want to get out and enjoy yourself? Consider Read Ride. I hear Dr. Jetmore may be participating in that. Read Ride is coming up on July 18th. You can still register at readride.org. Also, continue to get out. There is a couple of walking clubs that you can join. Richmond Walking Club is back Thursday evenings at 7 p.m. at the Glenn Miller Golf Course. There's also Hayes Arboretum having meditation hikes Thursdays at 6 p.m. So Thursdays, you can go walk and meditate at Hayes at 6 and then walk in Glenn Miller at 7, and you should pretty much be walked out and sleep like a baby. Ought to be all good at that point. And don't forget the Richmond Farmers Market continues to go on every Saturday. They have also opened up their Tuesday evening twilight markets. That's every Tuesday from 4 to 7 at Jack Elstro Plaza. So definitely get outside and enjoy. Thank you for watching this week's Ask the Doctors on Whitewater Community Television's WGTV Channel 11. Replays of this program can be seen tonight, all throughout the weekend. It's also available on our Facebook page. The doctors will be back again next Friday afternoon at 2 o'clock. As always, I wish you well. Have a blessed weekend.